I have to notify the House, in accordance with the Royal Assent Act 1967, that the King has signified his royal assent to the following acts: Lord's Spiritual Women Act 2015, Extension Act 2025, Commonwealth Parliamentary Association and International Committee of the Red Cross Status Act 2025, and Financial Assistance to Ukraine Act 2025. Which brings us to the next statement, if the front benches would like to swap over quickly. Statement. Government response to the Covid-19 inquiry, Module 1 report. Pat McFadden.
Thank you, Madam Deputy Speaker, and I'd like to make a statement on the Government's response to Module 1 of the Covid inquiry. In July of last year, Baroness Hallett published her report from the first module of the inquiry. It concluded that the UK was not as prepared as it should have been for the pandemic, and that more could and should have been done. And in my statement to the House, immediately following the publication of her report, I committed to responding in full within 6 months. Before I turn to the Government's response, I want to place on record once again my thanks to Baroness Hallett and her team for the work they have done so far in the inquiry. I also want to pay tribute to the families and friends of those who lost loved ones during the pandemic, some of whom are with us in the gallery today. Earlier this week, I visited the National Covid Memorial Wall just across the river from here, and I'm grateful to the friends of the wall who have so lovingly cared for it and maintained it over the past few years. As I said in my statement in July, the Government's first responsibility is to keep the public safe. That's why, since we were elected, we've taken steps to strengthen the UK's resilience. I announced a review of national resilience. Work upon that review is proceeding, and I will update the House upon its conclusions in the spring. The Prime Minister has established a single Cabinet Committee for Resilience, which I chair, and which meets to ensure clear and rigorous ministerial oversight. We have adopted the 2023 Biological Security Strategy to protect the UK and our interests from significant biological risks. In April, the new UK Resilience Academy will be launched. It will train over 4,000 people in resilience and emergency roles every year and help them plan for and manage a range of crises, including pandemics. And I should also acknowledge, as I did in my first statement back in July, that in some areas these improvements build on work carried out by the previous administration. The improvements that we've made to our resilience have been put to the test over the past 6 months. These include the Prime Minister chairing a number of emergency COBRA meetings to address the violent disorder that occurred over the summer, and working across our 4 nations to anticipate and contain Clade 1 Mpox cases in the UK. Since July, we've also sent 2 emergency alerts to provide advice to the public in life-threatening situations. During Storm Dara, for example, because of a very rare red danger to life warning, the alert was sent to over 3 million people in affected regions, and more recently we issued a very localised warning over flooding danger. The Government will carry out a full national test of the emergency alert system later this year. This will ensure the system is functioning correctly should it need to be deployed in an emergency. The Covid Module 1 inquiry found that years of underinvestment meant that pandemic planning was not a sufficient priority. Our health services were already suffering and beyond capacity, and there were high levels of illness and health inequalities. All of this meant that the state was ill-prepared to manage a crisis on this scale. So apart from the specific recommendations, that is why that delivering on the Government's missions, particularly in this context, building a National Health Service fit for the future will contribute in very important ways to the UK's resilience. Pandemic planning and resilience is not just about specific resilience measures. It is also about making sure that the underlying fundamentals of our country are strong. And I thank the devolved governments for their cooperation in preparing a response today. We'll continue to work together for the safety of the communities we serve. Turning to specifics, there are 3 new commitments in particular I wish to highlight. First, the inquiry recommended that the UK Government and the devolved governments should together hold a regular UK-wide pandemic response exercise. We agree. We will be undertaking a full national pandemic response exercise later this year. It will be the first of its kind in nearly a decade. It will test the UK's capabilities, our plans, protocols and procedures in the event of another major pandemic. It will be led by senior ministers. It will involve thousands of participants, run across all regions and nations of the UK, and alongside the Health Secretary, I've written to all Cabinet Ministers to ask for their commitment to full participation. The exercise will take place in the autumn over a number of days. The Government will communicate the findings and the lessons from this exercise as recommended by the Covid-19 inquiry. Second, the inquiry found that the pandemic had a disproportionate impact on vulnerable groups and continues to affect many people in those communities. A new national vulnerability map created by the Cabinet Office with the Office for National Statistics will geographically map population numbers of those who may be vulnerable in a crisis. And it will do this by sharing data including age, disability, ethnicity, or whether someone is receiving care. This map will improve the Government's understanding of the scale and location of disproportionately impacted populations ahead of enduring crises and enable targeted local support when required. Third, as the inquiry reminds us, the risks we face are changing more quickly than ever before, and we live in an increasingly volatile world. It therefore recommended a better approach to risk assessment right across the board, which we accept. And today I'm publishing an updated National Risk Register, the public-facing version of the National Security Risk Assessment. It provides businesses, the voluntary and community sectors with the latest information about the risks that they face to support their planning, preparation and response. We'll ensure it continues to be updated regularly. A significant proportion of the risks will be subject to reassessment over the next few months, and we'll publish a further updated risk register as needed once this process is complete. I want to mention 2 further recommendations where the Government accepts the underlying objective and proposes to take these forward in specific ways. First, the inquiry recommended Cabinet Office leadership for whole system civil emergencies in the UK. We agree with this. For whole system emergencies, such as a pandemic, of course, the centre of government needs to play a lead role. But for lower scale emergencies, we believe that the lead department model still has value. It remains important for government departments with the day-to-day responsibility for an issue to lead the work to identify serious risks and ensure that the right planning, response and recovery arrangements are in place. Therefore, in some circumstances, we will retain the lead government department model, because in these cases, responsibility and oversight should sit with the body with the best understanding, relationships and mechanisms for delivery to identify and address risks. And there will be an enhanced role for the Cabinet Office to improve preparedness and resilience for larger scale catastrophic risks. Second, the question of independent input into the whole system, civil emergency preparedness and resilience. We agree with the need for independent strategic advice and challenge, including the use of so-called red teams. We are establishing 8 expert advisory groups to combat groupthink in our understanding of risks. Alongside this, through the Crisis Management Excellence Programme, we will increase training in red teaming. We want to work with the local resilience forums that exist around the country, who provide critical knowledge and expertise. And the Government is also committed to introducing a duty of candour on public authorities as a catalyst for a changed culture in the public sector to improve transparency and accountability. And we will welcome and draw on the expertise of multidisciplinary pandemic science institutes that provide world-leading academic and scientific expertise, such as the excellent Liverpool Pandemic Institute, which I was pleased to visit yesterday. Of course, in the end, the Government must remain responsible and accountable for the policy and resource allocation decisions it takes. But we believe the external input of these bodies can add value to that decision-making. The impact of the Covid-19 pandemic was unprecedented in modern memory. It caused the loss of far too many lives. My thoughts and the thoughts of the whole Government continue to be with all of those who lost loved ones during the pandemic. Many of them feel grief, but not only grief, also anger, that as Baroness Hallett's report sadly confirmed, the country was not as prepared as it should have been. My department will monitor the implementation of the commitments made in response to the Covid-19 inquiry. And in all of this, we must remember that the next crisis may not be the same as the last. There is a need for flexibility in our planning and learning, and we'll build this into what we do. The Government also remains committed to engaging fully with the inquiry and awaits Baroness Hallett's findings and recommendations in subsequent module reports as she continues her important work. And I commend this statement to the House.
Shadow Minister Richard Holder.
Thank you very much indeed, Madam Deputy Speaker, and I'd like to thank the Minister for advanced side of his statement today and join his tribute to Baroness Hallett for her report. We all know how challenging the pandemic was, and sadly how the fact that far too many lives are lost, and I pay tribute to all the victims from across our country and the world. This is why the Conservative Government put into place the inquiry, and former ministers have been cooperating with its work, and I thank the Chancellor of the Duchy for acknowledging that in the House today. It is clear from the investigations and findings of the inquiry so far that response times and processes were too slow and disjointed. We know this and we recognise this. But it is also clear from the work of this inquiry that there was also an incredibly challenging process and that there are no easy answers. Module 1, as we have examined our country's pandemic resilience and preparedness. So I'll focus on that today. In the response, the Government has identified a number of overarching implementations from the module recommendations. We are broadly supportive of the Government's direction. It is, as the inquiry report notes, important to strengthen both cross-governmental communication and data sharing, and also communication and coordination between devolved administrations. And I'm appreciative of the fact that the Government recognises this. I also appreciate that the Government is taking forward the recommendation to ensure that the Cabinet Office has a clearer and stronger role in crisis coordination as well as in resilience coordination. And the Government has clearly signalled its intention to build on the work started under the last Government, who put together the Resilience Directorate within the Cabinet Office, with the goal of ensuring clear accountability and leadership for long-term resilience and crisis planning. And the steps the Government has set out, I hope, will successfully build on that too. I'm also thankful the Government is building on works which is the last Government set the foundations of around the Resilience Academy, and I look forward to tracking that progress as it goes forwards. But I also appreciate the Government have set out the intentions to strengthen the articulation of requirements for resilience and emergencies training qualifications, and this is also an important point to note. I'm thankful the Government is building on the work we implemented in establishing a new national exercising programme, and appreciate the Government is planning a full pandemic exercise for this year, but also acknowledge that the risks we will face going forwards will be dynamic, and that's an important point that we need to recognise because we do not know what the future will hold. So I hope that the pandemic exercise will involve cross-cutting segments of microbial resistance and technology infrastructure as well, which we know are going to be some of the key challenges that continue to grow in importance for the future. I recognise here that government has also emphasised the holistic work that can be conducted across organisations of all types as a result of the highly transparent risk register we first published in 2023, and I appreciate that the government setting out their intention to build on this and offer a wider range of scenarios and frameworks of the register in future. But I must say that the government does not seem to all throughout fully recognise that there also is far too much complication in the system. This risks masking fundamental matters of cross-governmental coordination with political measures. And while I recognise in the government's response the desire to ensure independent input into the whole system, civil service emergency preparedness and resilience, and in doing so establish a number of expert advisory groups, I would caution the government that these have to be backed up also by real accountability and progress tracking, so to ensure that the work conducted by these teams is clearly enacted in a transparent way for clear reasons. So they're not just talking shops. The government has announced a significant number of reviews, consultations and task forces. We know that without real accountability and framework clarity, these risk only being a temporary solution to long-term issues. And in particular, this is obviously a particular concern when it comes to national resilience. And so while we support the government's direction here, I do want to raise just a couple of questions. With regarding to the, particularly to recommendation 3 around the mapping which the Minister mentioned, very welcome there. I just wanted to, if he could expand a little bit on the combined impacts of different perhaps vulnerabilities for certain groups and how they can be overlaid within that mapping process. Regarding to recommendations 4 and 5, the whole system emergency strategy and that crucially that data element as well. Is the data there to support the strategy? What levels of confidence does he have that in the moment? Will he be using the UK Biobank potentially around that? There are obviously critical issues around academic freedom as well, as we're looking into some of these very complex issues with overlapping issues within communities across the country as well. In recommendation 6, I just wondered if he could elaborate what response so far he's had to the devolved governments. He says they've been very positive. If you could just go a little bit further. And in response to recommendation 9, particularly around the red groups, it did sound good to have those groups there, but I was worried a little in his statement when he said we are establishing 8 advisory groups to combat groupthink, and that's just sound a little bit of a tautology. I just want to ensure that those groups will be properly independent and ensure that challenge is actually provided to what the government's planning to do. With regards to recommendation 7, just briefly, Madam Deputy Speaker, this is quite an important point around the actual the reporting back on those reporting back the findings of the big nationwide investigations that are going to be undertaken. And it was just around the publishing and the timeliness. The report asked for 3-month publications. Could the Minister speak to that? And also around the issues at the moment. The Cabinet Office said there is scoping and testing solutions to resolve multi-agency reports. And I just wondered if the Minister could speak to that too. Finally, and thank you for your indulgence, Madam Deputy Speaker, we must not lose sight of the fact that there are shifting landscapes within this, and this is going to be a very long-term thing that we're looking at in response to this. I do want to point out that while I appreciate the government's response today, the government hasn't yet responded to the House of Lords Statutory Inquiry Select Committee report on reforming the process by which public inquiries are conducted from last year, and that's slightly overdue at the moment. So if the Minister could update us on the progress on that, I'd be most grateful, and also ensuring that we've got that tracker in place to ensure that when it comes to issues like this, or the Horizon scandal, or the infected blood scandal, we're always in the right place. Thank you very much, Madam Deputy.
Minister.
Thank you, Madam Deputy Speaker, and I'm grateful for the honourable gentleman's response and for his broad support for our response to this, including on the Resilience Directorate Academy and the full pandemic exercise. Let me try to turn to the questions that he asked. On the mapping, the data is getting better. One thing that has improved over time is the government's ability to gather and to use data, and it's important that we do that as well as we can. Data has been described as the new oil, and it's important that the government which has access to good data around the country, uses that in this case to map vulnerabilities and to try to make sure that the next crisis doesn't expose the kind of cracks in our society that happened the last time around. He asked about work with the devolved governments. Around those tables, people are not always of the same political party or outlook, but I have to say that on this issue, in my experience in the last 6 months, the spirit has been good. It's been one of cooperation, and it's been underpinned by the common understanding that when it comes to an issue like public protection, the public don't really care about your political differences. They expect all of us, whatever our political stripe, to work together for their safety and their common good, and that's what we should do. This issue of red teaming and challenge is important, but it's got to be put in the context. He mentioned accountability, and I said in my statement a few moments ago, accountability for the policy and resource allocation decisions has to ultimately rest with the government. So we are all for challenge, we're all for independent input into that, but at the end of the day, that's where the accountability lies, and that's who has to take the resource allocation decisions. We will publish the findings of the pandemic exercise. I do want us to see inquiries come to conclusions more quickly so that people can, victims of injustices can get justice more quickly. And the final thing I would say in response to him is he is right to say that the future may not be the same as the past, and that's why flexibility has to be built into all of this.
Bill Esterson.
Thank you, Madam Deputy Speaker. Can I thank my right honourable friend for his statement. I've been reflecting on those friends who sadly died during the pandemic whilst listening to his statement and to the Shadow Minister's answer. I'm sure everybody in the House will have their own examples. He mentioned the need for a new national pandemic planning exercise. After the last one of the press reports suggested that a recommendation was for senior ministers to act quickly if a pandemic hit us. Can he confirm that one of the ways in which, on his watch, improvements will be made in our preparation will be that senior ministers are ready and will make decisions in a timely fashion?
Minister.
I thank my honourable friend for his question. Well, this will all be tested in the exercise we plan to do next year. Now, past planning exercises, of course, sometimes plan for the wrong thing, and that is the danger here, and that's why I say all the time we've got to make sure that we learn from what happened through the pandemic a few years ago, but not make the assumption that the next pandemic or the next crisis is going to be exactly the same, and that's what we've got to do.
Liberal Democrat spokesperson Alison Bennett.
Thank you, Madam Deputy Speaker. The findings of this inquiry are a harsh confirmation of what we already knew. They are that the UK was woefully unprepared for this pandemic. The focus was wrong, the leadership was lacking, and the lessons from past crises were not learned. I'm sure I speak for all honourable members when I say that our hearts remain with those who lost loved ones during that tragic time, and thank those family members who are in the gallery today to join us. To do right by them, crucially, we must ensure this is a turning point. It is essential that the new government takes swift and decisive action to prepare for next time. And so I welcome the Minister's announcement of a pandemic response exercise this autumn, but I ask, will this be a one-off, or are further exercises planned? And if they are, how frequently? And as well as the different, more proactive approach to disease outbreak preparedness that Baroness Hallett cites in her report, we must invest in public health rather than simply throwing money at crises when they materialise. So, a second question. One of the key findings is that health inequalities and a less healthy population has left the nation less resilient. Does the Minister agree with me that public health should be a priority? And does he agree with me that the public health grant, with the proportion set aside for those experiencing the worst health inequalities to co-produce plans for their communities, would be a step in the right direction? We need to help more people live more years of their life in good health. And when I think back to those COVID years, I think of the appalling loneliness and isolation of those in hospital and care homes. So does the government agree that patients and care home residents should be given a new legal right to maintain family contact in all health and care settings? And finally, in terms of resilience forums, will the Minister confirm what funding plans there are in the future for resilience forums? I was aware before Christmas that there was some lack of certainty about that, certainly what I was hearing from my own Sussex Resilience Forum. We cannot risk our country not being ready for the future, and these are important questions. Thank you.
Minister.
Thank you, Madam Deputy Speaker. The most fundamental thing, apart from specific recommendations or specific changes, is the underlying strength of the country and its services. And that is nowhere more true than in the National Health Service itself. And that is why the budget, which has been attacked a lot, put the resources in to start to begin to turn the health service round. Because you can have the forums, you can have the structures, you can have the processes, but the underlying strength of the country is the most important thing. She asked about the exercise this autumn. I very much hope it won't be the last, and the inquiry recommended that these happen on a regular basis, but it's going to be the first for many years, and we want to make sure we learn as much from it as possible. And in terms of funding for local resilience forums, they play an important role. We were able to put some increased resources into local government in the next financial year, and this area, as with others, will have to be considered in the round in the spending review that will be published later this year.
Graham Stringer.
Madam Deputy Speaker, I'm less sanguine about this report than my right honourable friend on the front bench. The report, or it's part of a report, isn't it, which is difficult to assess when you don't know what the rest of the report will say, has been too expensive and it's taken too long to produce. And reading it, it doesn't seem to me that some of the fundamental questions that I would like answered and my constituents would like answered. What were the cost-benefit analysis of the decisions taken during lockdown, for instance? Well, lockdown itself, was that a benefit or disbenefit? Was effectively closing down the NHS apart from COVID patients? What was the cost of that? Where did the virus come from? Did it come from China, which most of the evidence seems to indicate? So those questions aren't being answered, and I don't believe setting up a new quango in conjunction with the Cabinet Office, which has no experience of service delivery, is going to be the answer to any future epidemic, and this report is not answering the questions I would like answered.
Minister.
Thank you, Madam Deputy Speaker. I hope my honourable friend doesn't think I'm sanguine. I'm not sanguine at all, and anyone who reads the National Risk Register shouldn't be sanguine, because, as I said in my statement, we live in a world of risk and vulnerability. In terms of the inquiry's work, the inquiry is independent and is not instructed by the government in terms of the specific areas it goes into. It has 10 modules. It's decided by the inquiry itself because it is an independent inquiry.
Sir Bernard Jenkins.
Thank you, Madam Deputy Speaker. May I kind of echo the sentiments of the honourable gentleman from Middleton and Blackley and Middleton South about expressing concerns about this inquiry. The right honourable gentleman, the Minister, has been clear that he wishes it was not taking quite so long. It's taking far too long. And what can we learn from other countries about how they have conducted their lessons learned exercise in order to make sure that the people watching these proceedings who lost people, who lost their loved ones, feel that something has been done and something has been done in good time. This is by no means the first public inquiry that has taken too long. The right honourable gentleman is in the great position not being responsible for the setting up of this inquiry, but will he set out what he thinks we should learn from failed and lengthy inquiries in order to make sure that we do these very urgent lessons learned exercises very much more quickly, because the next emergency could strike tomorrow. We haven't got time to hang around and have these very long blame-fest inquiries with criminal lawyers asking gotcha questions to get headlines.
Minister.
Thank you, Madam Deputy Speaker. And I think in the honourable gentleman from the front bench's response, he also asked about the general question of inquiries. I do believe there's a legitimate question to be asked about can there be a quicker way for the state to admit when it's wrong and get justice for the victims. But it's important in the processes that we set up that we don't lose the valuable question of independence, and we don't lose the valuable capacity these inquiries have for the victims themselves to have a voice which has sometimes been denied in other areas. But we have to have a system where the state can admit when it gets things wrong and get justice who have felt the consequences of that happening.
Ben Carman.
Thank you, Madam Speaker. I was a cabinet member during COVID responsible for public health, and I have to say, listening to the Right Honourable Member's statement today, I feel so relieved that we are about to replace the chaos that was experienced by me and so many people across the country at that time with a forward-looking, orderly, strategic approach. And I'm particularly pleased by, among the many things that have been mentioned, by the idea of creating a national vulnerability map, because that's hugely needed. May I just ask, hearing that the Department is going to monitor the implementation of the commitments that have been made in response to the inquiry, will the Department then come to this House, will he come to this House regularly to update on the implementation of those commitments?
Thank you, Madam Deputy Speaker. This is just Module 1. There are other modules to be published, and so I will update the House in some form when the Government responds to those. And of course, on top of that, there are regular opportunities to question me and the ministers in the office, either at oral questions in front of select committees and so on.
Danny Kruger.
Thank you very much, Madam Deputy Speaker. May I associate myself with the observations of the Honourable Member for Middleton, for Blackley, Middleton South, and also my right honourable friend for Harwich. The fact is we have an absolute urgent imperative to address the dysfunctions of the British state that were exposed by the COVID inquiry, and I agree with everything that's been said about how bad things were in early 2020. And while I welcome what the Minister is saying about the importance of a stronger centre, a more accountable Cabinet Office, I think that's the right direction to be going in. Does he also recognise that the parts of our society which didn't fail in 2020 were the parts very far from Whitehall, local government, the private sector and our communities themselves? And does he agree with me that while the focus needs to be on improving Whitehall's response, we also need to think about the resilience of local communities and ensuring that they can play their part in the next crisis?
Minister.
I think the Honourable Member makes a very good point, and my experience in Wolverhampton, which I represent, was the local authority did a great job of looking out for vulnerable people. An inquiry, perhaps by definition, places the emphasis on things that went wrong, but there was a great deal of experience during the pandemic which showed the best of society and people looking out for one another and helping those who were vulnerable, and so we should draw on the things that went well as those that went wrong.
Lizzie Collins.
Thank you very much, Madam Deputy Speaker. In my previous role in health scrutiny in Lancashire, I got a bit fed up of hearing from Conservative politicians that no one could have seen COVID coming, as if a global viral pandemic was not top of the NHS risk register for years, as if epidemiologists didn't warn authorities that it was a matter of when, not if. So does the Minister agree with me that it was a disgraceful abdication of responsibility when the former government pleaded ignorance to the well-known risk of a global viral pandemic? Thank you.
I thank my honourable friend for her question. There is a risk in always planning for the wrong thing, and it's a risk that I am very aware of as we try to do this forward-looking exercise. I was encouraged by what I saw yesterday at the Liverpool Pandemic Institute about the scientific expertise that we have in the country, is trying to take the learning from that in the past and make sure that we don't believe the next situation will be the same as the one that we went through several years ago. It might be something similar, but it might also be something very different, which is transmitted differently and creates a whole different series of questions and requirements for the government of the day.
John Cooper.
Madam Deputy Speaker, thank you. I'm delighted to hear that relations with the devolved administrations are now on a collegiate basis. I have to say that my experience as a lowly special advisor with the Scotland office at the tail end of the pandemic was nothing like that at all. It was very, very difficult, and we faced constant battles with the Scottish Government, who wanted to get their oar into areas that really were nothing to do with them, constantly wanted change for the sake of change. So I am relieved to hear that the Cabinet Office seems to be taking a lead in this. Can the honourable gentleman assure me that going forward, and heaven forfend that we face another situation like the COVID pandemic, but we probably will. Can he assure me that we will have a chain of command which makes it clear who is in charge, and it must be this sovereign Parliament?
Minister.
Madam Deputy Speaker, I said on this issue cooperation was good, but of course we live in a world where that might not always be the case on everything. But I do think when it comes to public protection, people should leave their politics at the door and ask themselves just one question, which is how do we protect the public and how do we get the country through this?
Joanna Baxter.
Thank you, Madam Deputy Speaker. I declare an interest as the chair of the all-party parliamentary group on vulnerable groups to pandemics. I welcome my right honourable friend's statement today. One of the most striking conclusions from the COVID inquiry was that it was the most vulnerable people in our society who were the hardest hit, whether that was because they had pre-existing health conditions or because they were on some of the lowest wages in this country. Can the Minister tell the House what steps are being taken to ensure that in the event of another incident of this nature, that support reaches the most vulnerable people in our community much more quickly than it did in the previous COVID pandemic?
Minister.
I thank my honourable friend for her question, and she is right. Cracks in our society were exposed. This did not affect all parts of society equally. We have to learn from that and respond to it. The very concept of having a society should mean that in an emergency we pull together and we try to overcome it together. The map that we are producing will help us somewhat in identifying where those risks are. But as I said in my statement, the most important thing is the underlying strength of the country and its institutions, and in this context, specifically the National Health Service itself.
Max Wilkinson.
Thank you, Madam Deputy Speaker. In Cheltenham, in Sanford Park, we have an avenue of trees which is planted in honour of the COVID heroes and the many victims that our town suffered during the pandemic. Not far from there is a playground, and that playground was shut, and there is nothing more dystopian for children than seeing the playground that they cherish shut, and children do not often have a voice in these kind of discussions. Can the Secretary of State confirm to me that next time we get to a pandemic, we take a much more reasonable approach to risk as raised in the module, and also that children will have a bigger voice so they don't suffer the mental health problems as a result of pandemics that we know so many of them are?
Minister.
This is something the inquiry intends to look at in the future, but let's state the obvious. If you were parents of young children in a flat with no outside space, you had a very different experience of the COVID pandemic compared to someone with a nice big garden. That is true, and you know, I totally understand the public health decisions that were taken, but they didn't affect everybody in an equal way, and that is something to ponder for the future.
Debbie Abrams.
Thank you, Madam Deputy Speaker. And I welcome my right honourable friend's statement today. As a former public health consultant, I looked at in amazement, to be honest, in terms of what happened during the pandemic. So I welcome the fact that it's acknowledged and recognised in this report that exercises Alex and Cygnus were ignored, that contributed to our lack of preparedness, that we had a declining nation's health and exacerbating health inequalities. Another point that was raised within the report, but also in the film The Unequal Pandemic, was the point about the fact that there was such a low awareness around the functions of public health. It was being reinvented at the centre. None of the legislation and regulations around public health protection were known. And I'm talking from directors of public health who've reported that back to me, who went into COBRA meetings where there's a total absence of understanding of basic legislation in this regard. Can my right honourable friend reassure me in terms of the relationship between the centre and local public health teams, which were decimated because there was such a lack of understanding about public health as a whole, but particularly in terms of their health protection role, and that this issue about reinventing the wheel won't happen again?
Minister.
Thank my honourable friend for her question. I specifically mentioned local resilience forums in my opening statement for a good reason. I think it's really important that we recognise in an emergency the centre and local government and the devolved governments, as I said a moment ago, have to work together in the best interests of the public. And I also endorse what she said, as I've said a few times today, about the importance of the underlying strength of our health system in an emergency like this.
Dr. Kieran Mullen.
Thank you, Madam Deputy Speaker. I want to begin by saying that whilst the loss of every single life is of course tragic, and I saw that volunteering myself firsthand, I think it's important to note, despite repeated political attacks at the time suggesting we had the worst death rate in Europe, now when we look at the figures properly, we had actually a lower death rate than countries like Spain and Italy, and we're broadly in line with Europe. I would caution against diminishing the results of a national effort that actually are broadly in line with other countries in a desire to make political attacks on the Conservative Party. But in terms of my question, as exhaustive as the inquiry's proposals to look at things are, I, to my mind, see a big gap, and that relates to the decision-making of MPs, which is, you know, when I've seen all the things it's going to cover, it doesn't seem to cover that. Those of us on the government benches, and equally could be said of those on the opposition benches, were often faced with very difficult votes that were expected to go down to the wire and were asked to make very difficult decisions. And actually, the access of MPs to independent advice, scientific briefing, I don't think was anywhere near like it should have been. If he agrees with me that it isn't part of the current inquiry, can he at least admit that accept a task for the government and the cabinet officers to think how we can better equip MPs with the information they need to make on important votes of that nature?
Well, can I thank him for his service to the public during the pandemic, and anybody who worked or volunteered in the NHS or in other ways for what they did. Of course, MPs and government have to have access to the best information they can. But I remind them of something else that I said in my opening statement. In the end, the accountability for policy and resource allocation decisions lies with the government of the day. I don't say that in a partisan way. I think it's important to establish it as an understanding of how we deal with these things in the future.
Dr. Scott Arthur.
Thank you, Madam Deputy Speaker. I pass the National COVID Memorial Wall every day on my way to this place, and this inquiry is a reminder of what happens when governments get things wrong. I absolutely welcome the announcement of a national pandemic response exercise later this year, but the inquiry has already found that a similar exercise took place in Scotland under the control of the Scottish Government before the pandemic, and it failed to implement the conclusions from that exercise. Can the Minister reassure us that any outcomes from such exercise will be reported to this House and we will have oversight of the implementation of any recommendations? Secondly, I know it's outside the remit of the Minister's statement, but can he give us an update on the recovery of any money lost to dodgy contracts to the mates of the previous government? Thank you.
Minister.
I thank my honourable friend. Let me repeat the praise I gave to the volunteers who maintain the COVID Memorial Wall. Honourable members may not be aware, when they look at those red hearts, that over time they fade, and they fade to pink. And the reason that they are kept red is there are a group of volunteers down there overpainting the hearts to make sure that that wall doesn't fade away, and that the memory of the names recorded doesn't fade away. The conclusions of the national pandemic exercise will be reported, and prediction's a dangerous game, but let me make one. There will be things that go wrong. There will be shortfalls that will be exposed. Not everything will go right, but that's part of the purpose of doing an exercise like this. So I'm happy to assure him about that in terms of learning from it and the conclusions.
Seamus Logan.
Thank you, Madam Deputy Speaker, and I thank the Minister for advance side of his statement. I also completely agree with him that in these matters, people, the public, don't care about party political differences. Now, I note his commitment to an independent whole systems, civil preparedness and resilience process going forward. I'm just looking for some reassurance that there will be the full involvement and consultation with devolved governments in that respect. And like the honourable member opposite, I want to press him on this issue of recovery of some of the very wasteful PPE contracts which were awarded during the pandemic.
As the honourable member will know, we've appointed a COVID fraud commissioner to try to recover as much as possible of some of the money that went wrong. I have not sought to be partisan today, but I do believe that the systems that were in place were wrong, and that there were some abuses and there was significant loss of money. And when we are in a situation where we want value for money for the public, we want to recover as much of that as we possibly can. And I repeat, relations with the devolved governments on this kind of issue have been good so far, and I hope that that is a case that's maintained through this national pandemic exercise that we're planning.
Andrew Lewin.
Thank you, Madam Deputy Speaker. We all lived through the pandemic, and we all came to see the immense value of our key workers. The bus drivers who had to continue to make those essential journeys, the carers who had no choice but to continue to provide close quarters care, and the posties, some of whom I met recently in Welwyn City at their delivery depot in Bessemer Road, who told me that when they had conversations, socially distanced conversations on the doorstep with lonely residents, it was often the only human interaction that they had all day. Would my right honourable friend, the Secretary of State, reaffirm to me how important this government believes the role of key workers is, and that critically that we make sure that for the next pandemic we have measures in place to ensure that they are protected and supported?
Minister.
My honourable friend raises an excellent point. Let me echo his praise for all the key workers that he mentioned. We found out when the chips were down who was keeping the country going, and let me, from this dispatch box, thank each and every one of them for what they did to keep the country going during those very difficult times.
Sir Christopher Sharp.
Madam Deputy Speaker, the Minister quite rightly expresses sympathy for the victims of Covid-19, which is something we all share. But he hasn't mentioned anything about the victims of Covid-19 vaccines, of whom there are thousands, and we know at the moment that those people did the right thing. They took the vaccines. They weren't warned of the risks, and the Minister's been talking about risk assessments. There was a lack of risk engagement, and now we find that the compensation scheme, the vaccine damage payment scheme, is in place, but is not actually operating effectively or fairly, and the Health Minister keeps talking about possibly amending it, but every time he mentions that, it causes immense harm to all those people who are still suffering as a consequence of having done the right thing and taken the Covid-19 vaccines, when now many of them would have wished they didn't.
Look, let me say to the honourable gentleman, I believe that the production of the vaccines and the distribution of them was one of the things that went well, that this country contributed to, and that the availability of vaccines helped us to overcome the pandemic. In those cases where there were adverse reactions, there is a scheme in place, as he said, and my right honourable friend, the Secretary of State for Health, has met people affected by this, and of course we want to help people affected by this through the kind of scheme that exists.
Dr Alison Gardner.
Thank you, Madam Deputy Speaker. Firstly, can I thank the Minister for commenting on the importance of multidisciplinary research. I know from my own previous research that's very important, particularly in the development of AI algorithmic risk prediction models. I also had the pleasure to speak to Professor Tom Solomon yesterday, the director of the Liverpool Pandemic Institute, and which the Science, Innovation and Technology Committee had the pleasure of visiting recently. He impressed upon me the value of physician researchers in conducting groundbreaking research. Will the Minister agree with me it is vitally important we provide the time and funds to researchers such as Professor Solomon to help build our national resilience to future pandemics?
Minister.
Let me echo her praise of Professor Solomon and the work that he's doing, the work that the Pandemic Institute is doing. He is absolutely right, and she's right, to underline the value of research. We've said all the way through this statement, the next crisis the country faces may be very different from the last. So it's really important that we use one of the great assets this country has, which is tremendous research institutes and research capability, to scan the horizon as well as we can and be as well prepared as we possibly can.
Neil Shastra-Hurst.
Thank you very much, Madam Deputy Speaker. And having served on the front line during COVID, I am acutely aware of the sacrifices made by clinicians, patients and their staff. But part of the solution to preparing for any future pandemics is ensuring that we've got robust epidemiological research. And I wonder if the Minister can go into some more granular detail on what assessment he has made of the current projects that have been commissioned by the Government.
He's right about the need for robust research. I don't analyse the research projects one by one. I do thank him for his service, and I underline what I said a few times today, that the best insurance we can have in terms of responding to another crisis like the one that we went through some years ago is underlying strength of the country, is underlying strength of the NHS, and that's why we have made the decisions to put resources into it to help to turn it around and make it stronger in the future than it is today.
Antonia Bands.
Thank you very much, Madam Deputy Speaker. I spent the pandemic as a trade unionist at the TUC supporting now Baroness O'Grady to fight for the right to safety of working people. And the COVID inquiry heard time and time again about the impact of the pandemic on those on low wages and insecure work, people who had to go into work even when it wasn't safe or they couldn't feed their families. And they were disproportionately black and minority ethnic workers. So will the Chancellor make sure that the new National Vulnerability Map treats insecure workers as vulnerable for the purpose of crisis planning and resilience? And will he make sure that unions are key stakeholders in building the UK's resilience?
I thank my honourable friend, and she's absolutely right to underline the need to thank the key workers, many of whom were low paid, many of whom did come from ethnic minorities, who kept the country going and sometimes had to put themselves at risk to help and protect the rest of us. So I absolutely thank her and those who represent working people for the work that they did during the pandemic.
Steph Ackroyd.
To the specifics of the Government's response to Module 1, I'm really interested to hear about the National Vulnerability Map, which could help with a range of things like digital exclusion as well as public health. I'd like to ask him about this on 2 points. Firstly, has he taken into consideration the findings of Chris Whitty's report in 2021 into coastal communities and their specific vulnerabilities? And also, could I urge him that, obviously this is a hugely valuable undertaking, but I don't want to see us create a one-trick pony. Could he possibly look to seize the bigger opportunity to build a better system for storing and using citizen data that could benefit everyone and get all sorts of people the support they need when they need it? Thank you.
As I said a little while ago, data has been described as the new oil, and there are good reasons for doing it. And I believe there is a duty on government and the state to try to use that to get the best outcomes for the public. And part of this is an example of using data to map where our vulnerabilities are. And while I've been praising people for what they did, let me also include Sir Chris Whitty, the Chief Medical Officer, for what he did then and what he continues to do today. The country is very lucky to have him, and I thank him for everything that he does.
Helena Dolinor.
Madam Deputy Speaker, and I thank my right honourable friend for his statement. It is a source of national shame that our country was so underprepared for the COVID pandemic, and the party opposite need to take their fair share of the responsibility for that. We all worry about where the next pandemic will come from, and can I express my particular concern about the risk posed by dengue fever, which, for those who aren't aware, is a disease spread by mosquitoes. It has been travelling closer and closer to the UK in recent years due to rising temperatures and climate change, and it has most recently been found in Paris. As a Member of Parliament for a constituency on the South Coast, I am particularly worried about the warning that it could be within the UK within years. There is currently no cure for dengue fever, but there is a vaccine going through trials thanks to the international collaboration that our country is part of. So can I ask the Minister what steps the government is taking to improve our preparedness for the next pandemic, wherever it may come from and however it may be transmitted?
I thank her for her question. She's right that one of the risks that we face is mosquito-borne diseases and viruses of various kinds. The UK HSA monitors mosquito-borne diseases so that we've got the most up-to-date information we possibly can. It's a good example of scanning the horizon and understanding that the next crisis you face may not be the same as the last.
Richard Tice.
Thank you, Madam Deputy Speaker. I agree with other honourable members who've said this inquiry is taking too long, it's costing too much, and in many cases not asking the right questions. The previous pandemic response exercise some 9 years ago, Operation Cygnus, the results of that were so shocking they were kept from this House and the British people. So will the Minister commit that the results of this pandemic exercise later this year will be transmitted totally openly with full transparency to this House and the British people?
I thank him for his question. Two questions really. I've said what I said on the speed of the state's admission of when things go wrong. I think we do need to think about that and look at that. In terms of the results, yes, the findings of the exercise will be made public, and let me repeat my prediction of earlier. It will probably show things that have gone wrong and areas where we need to improve. And I think anyone who carries out such an exercise and doesn't expect that is going to face a nasty surprise.
Anna Dixon.
Thank you, Madam Deputy Speaker. One of the positives that we saw was an outpouring of neighbourliness. Churches and faith communities played a key role in mobilising support to those most in need during the COVID pandemic, delivering meals, shopping and prescription medications to those who were advised to stay at home. So will the Minister join with me in paying tribute to all those volunteers and assure the House that faith communities and other community organisations will be involved in the local resilience forums, ensuring they're integral to both the resilience planning and incident response? Thank you.
Can I thank my honourable friend for her question? She's absolutely right. Many of these efforts showed the best of us and how much people were prepared to look out for one another. I was really touched by the efforts of, for example, the Sikh Gurdwaras in Wolverhampton in distributing food to people of all faiths and none, and by other faith groups and community groups who also did similar things to help the most vulnerable people during the pandemic.
And the final question on this statement, Jo White.
Thank you so much, Deputy Women Speaker. I want to place my respect to all those we have lost, and I give my heart to those who've lost loved ones and have to live their lives without them. In Bassetlaw, I've met many families who have needlessly lost loved ones, and my good friend Pete Armitage, who died on the 6th of April 2020, in hospital, unable to breathe, without his wife by his side, and only 6 of us at his funeral. But I want to take this opportunity to pay tribute to those volunteers who stepped up, who went out without any fear for their own health or their lives, who delivered food, who stood on the vaccination lines, who helped at the local food banks. I want to ensure that we in Parliament never forget those names. I want to pay tribute to them here, and I ask the Ministers to do the same.
Well, in my final answer of the afternoon, Madam Deputy Speaker, let me just warmly endorse what my honourable friend has just said on both counts. Let us remember all those who lost their lives and give thanks to the many relatives and friends who are keeping those names alive and trying to make sure that we learn the lessons from what happened in the past. And let us praise all the volunteers who help people in any way. It was a very difficult and tough time in this country and in others. But those efforts, that reaching out, that showed the best of us, and we shouldn't forget it.
I'll now give a few moments for the front benches to swap over.